Do you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Thank you for tuning in to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, I want to talk with you guys about complementary and alternative medicine. So although I've been pretty straightforward with y'all in the past about how I am on Prozac for my anxiety and depression, I also am a big fan of complementary and alternative medicine. I think that there are some things that we need modern medicine for, like fighting viruses and bacteria, but I think that there are also some really good holistic approaches that we can use with like homeopathy and naturopathy. So today we're going to talk about a couple of those. Firstly, let's go ahead and define what I mean when I talk about complementary and alternative medicine. So I consulted the National Center for Complementary and Integrative Health to really get a great explanation of this for us. So what do these words really mean? We're going to talk about complementary, alternative, and integrative. According to a 2012 national survey, over 30% of American adults and about 12% of American children use healthcare approaches that are not part of conventional medical care. And a lot of them also originate outside of Western practice. So when we talk about these approaches, a lot of people use terms like alternative and complementary healthcare kind of interchangeably, but they technically mean two different things. So if a non-mainstream practice is used in combination with conventional medicine, then it's considered to be complementary. But if you use it in place of conventional medicine, then it's going to be considered to be alternative medicine. So a lot of times you'll see these referred to together as complementary and alternative medicine, or referred to as CAM. So I might use the term CAM as we go along as well. A lot of people use conventional healthcare in combination with these non-mainstream approaches, and that is totally fine. We're all on these different paths together, and we are finding what works best for us. In my personal experience, I like to have green tea to help me stay calm, but I also will get some Himalayan incense, and it really helps with my just chilling out and focusing. The one that I get comes from Dharma Shop, and I believe it has frankincense in it. It's supposed to be 100% pure natural substances. In a pinch, if they're out of it like they are right now, then I will use sandalwood or something instead. That Himalayan incense is my favorite though, and it really helps me chill out. Now, is that all on my mind, or is it actually effective? Who's to say? But as we've discussed before, the placebo effect is real. So in the end, if it has an effect for us, does it really matter? I'm not sure. I just go ahead and use the incense in addition to my Western medication, and that is what works best for me. You may also hear people refer to complementary and alternative medicine as functional medicine. So it's kind of similar to integrative healthcare, which we'll discuss in a minute, but it can also refer to an approach that's closer to naturopathy. Now, I am a big fan of homeopathy and naturopathy because as an anthropologist, I also recognize that medicine originally came from the plants around us. Even when you go to the doctor and they, like the dentist, and they give you Novocaine or lidocaine, those are cocaine derivatives. And they're not going to get you high per se, but it is a good numbing agent. So if you've ever seen a TV show with cops in it where they are rubbing cocaine on their gums, that is what they're doing. They're rubbing it there to see if it's going to make their mouth numb. And if it does, then it's cocaine, or it has a large enough quantity of cocaine in something that has been cut in order to count as being cocaine, in order to make it numb enough to indicate that it's coke. So, in that case, we have a lot of really good medications that have come from these plants. Cocaine originally came from a plant, and Coca-Cola used to have cocaine in it. So that's not really surprising to a lot of us at this point. We all have social media. I think a lot of us have seen memes joking about that. But we also have a lot of medical marijuana going on now, and CBD and CBD derivatives. So we're in this new age where people are more likely to embrace more of the naturopathy than we were before. But even previous forms of birth control, like those that the Romans used, were plant-based. That plant has gone extinct now, allegedly, but they have some that are kind of cousins or believed to be cousins of it that they're studying to see how that may have worked. And they think that it changed your hormone levels, just like my Western birth control does now. It adjusts my hormone levels throughout the month. So I think that that's very interesting, and that's one reason why, even though I'm a big fan of modern medicine, I also really like complementary and alternative medicine as well. So what is integrative health? That is going to bring conventional and complementary approaches together in a way that's really intentional and coordinated. So it's going to be holistic. So biopsychosocial, just like anthropology is that way, wellness and health is that way, so is integrative health. It's also very patient focused. So it's not just a one size fits all. It's, hey, what are your individual symptoms? What is really bothering you right now? And it also includes mental, emotional, functional, spiritual, social, community aspects, and financial aspects in a lot of ways. It's treating the whole person rather than just one organ system. So I really like that approach as an anthropologist as well. It's really well coordinated, and there are a lot of providers now who work together to deliver that type of experience. One of my friends has cancer right now, and they have this new concept called a nurse navigator, which is kind of like your cancer concierge in a lot of ways. So the nurse navigator is this really awesome position where they help you figure out exactly what you need to do next, what your journey is going to look like, and helps you find which other types of doctors or integrative health approaches you're going to use. So they encourage complementary medicine as well. It's really great, in my opinion, and my friend's nurse navigator is absolutely outstanding. These women, and ostensibly also men, the only ones I've met so far have been women, are really awesome and really care about people. And it's really cool to see an integrative healthcare approach for people who are in this situation. I also like that they're there just to anticipate the issues that people going through this experience will have. And it's really, we're living in the future, you guys. We're getting to the point where we are doing conventional medicine married with non-stream practices as well. And I think it's really great. One use of integrative approaches to health and wellness that have really grown across the U.S. and has been a lot of it for pain management. That one is one of the big ones for me. I do take an integrative approach for my pain management as well. So I'm not really keen on taking ibuprofen a lot or any other non-steroidal anti-inflammatory drugs, also called NSAIDs, because they can have damaging effects on some of your organ systems if you take them long term. I am not a big fan of that. But if I am having a lot of pain, then I will try some integrative healthcare approaches. I'll do some relaxation techniques, or I will go to a chiropractor as well, although it's kind of hotly debated in the chiropractic community as to whether that's considered to be CAM or not, because a lot of the CAM principles kind of go against the chiropractic philosophy, but that is a subject for another podcast. So you can use it for pain management. You can try to use it for relieving symptoms in cancer patients. So a lot of those are going to be like nausea and pain for cancer patients, and just improving their appetites as well. So there are several different types. You can also use it with mental health approaches. There are so many different types of complementary health approaches, and a lot of them are mind-body as well. So we're going to talk about a couple different kinds of those right now. They have natural products like herbs, vitamins and minerals, and probiotics. So probiotics do count as a complementary type of medication. Anytime I go on antibiotics, my doctor always recommends probiotics as well, and I really appreciate that. One of my previous doctors, her first recommendation when I was having trouble with insomnia was to get me to try some vitamins and supplements, or to go ahead and get them through my food instead. So I really appreciated her attentiveness to that approach as well. Technically, they're both nurse practitioners. I prefer nurse practitioners over, doctors a lot of times. In my personal experience, they seem to be more holistically minded, and they tend to have a better bedside manner. That's just me and my experience. If your doctor is dope, absolutely stick with who feels right for you, because we're all different types of people. Now, you can usually get a lot of those things online, those natural products. You can get them through Amazon. You can also just go in and talk to your doctor about it, and sometimes they can write you prescriptions for some of them that are going to be way cheaper than getting them over the counter as well. I don't know if you guys know that, but you can get different types of ibuprofen as well from your doctor. They can write you a prescription for it, and it's like $4 in some cases. Check with your local pharmacy before you go and try that and everything. I don't want to waste y'all's time. But the last time I went, they were able to give me a lot of ibuprofen that was a higher milligram percentage or milligram amount, and they were able to do that, and it was cheaper than if I had bought it over the counter. But you can also use a lot of dietary supplements other than vitamins and minerals. There are a whole bunch of those. I took some Chinese herbs when I was about 15 or so, because my period wasn't regular and I wasn't on birth control or anything at the time. I wasn't sexually active, so for me that wasn't really necessary. I didn't have a lot of acne or anything else that tends to address either. So one of my neighbors went ahead and gave me some of these Chinese herbs that she had, and I believe they are called dong quai, if I'm remembering that correctly, and it totally put my period right on track. I started menstruating all like clockwork, and I started having more cramps afterwards as well, but I don't think that was really necessarily due to the dong quai. It was probably just getting older and menstruating more that did it. But it was really interesting to me that just totally changed it around. So I'm a big fan of doing natural products or taking these natural products. I am not that into essential oils at this point. I do have a lot of friends who are though, and I get that works for them. I just haven't really forayed into it, to be honest. But I do like to use lavender essential oils to help me sleep a little bit. I just love the smell, and it's nice and calming when I'm trying to go to sleep. And also my tita gave me a roll-on essential oil thing. I don't remember the name of it, but I have it here in the house, and it does help me actually with my cramps if I am menstruating at the time. So that's pretty cool. I like it, and I encourage you guys to check out some different types of complementary medicine if you feel that may be right for you. We're going to go on a quick break, and when we come back, we're going to talk some more about integrative health, beginning with mind and body practices.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
Welcome back. In our last segment, we were introducing the terms of complementary, alternative, and integrative medicine and what that really means for each of us. We also discussed a little bit about natural products like taking supplements or Eastern medicine or probiotics. Now we're going to talk about some mind and body practices. So what are mind and body practices within the world of CAM and integrative health? Those are going to be a very wide range of practices from yoga, chiropractic and osteopathic manipulation, meditation. Those are the most popular ones. You can also do Pilates with that as well, Tai Chi, Qigong. There's a whole bunch of those that are meant to really put your mind and your body in sync with each other. Yoga in particular has grown dramatically in recent years. In 2012, only 9.5% of U.S. adults who were polled said that they practice yoga, and then that increased up to 14.3% in 2017. I am sure that it has also grown a lot more since then, because we are now in 2020. There's also a 2017 study that found that meditation increased from 4.1% in 2012 to 14.2% in 2017. So it's growing a lot and very rapidly in regards to people turning towards a lot of holistic medicine and mind and body practices. So some other mind and body practices that you might not consider to be mind and body practices at first include acupuncture or relaxation techniques. I'm a big fan of certain types of relaxation techniques. There's breathing exercises. You can do guided imagery. So a guided mindful meditation is one of those. You can also do progressive muscle relaxation. So that's one of my absolute favorites, and I do that every day. You can also do hypnotherapy, and then there are a bunch of other types of integrations that are even more complex. So we're going to talk about this primarily at, a higher level today. We're not going to really delve into all of the more complex ones like the Alexander technique or the Rolfing structural integration, but we may talk about those in a later podcast. Hit me up on Instagram or Facebook or Twitter if you would like to see some of those. It really helps guide me in seeing what you guys actually want to hear about. So the amount of research on mind-body approaches is really widely variable. It depends on each individual practice. So people have studied a lot more on acupuncture, yoga, and any type of spinal manipulation or meditation than they have on a lot of other practices. Those are just easier to study. They've been around a very long time, and it's just overall more accessible for researchers to study. They're also the ones that people use predominantly, so the more people use it, the more it's going to end up being studied. Now, there are a bunch of other complementary health approaches as well that don't fit neatly into either the mind and body practice or the natural product, kind of categories. And that's okay. There are traditional healers, Ayurvedic medicine. I apologize if I butchered the pronunciation of that. There's also Chinese medicine that's traditional in nature, homeopathy, naturopathy, and functional medicine. So there is a whole host of different options out there for each of us. Today is going to be more of an approach of letting you guys know what the options are, and then you guys can dig into those some more on your own, or we can go in depth to them in a future podcast. So there are different types of CAM, though, that really are going to depend on who you are as a person and what you're comfortable with as to which one you may choose. And a lot of them overlap with other ones. So, for example, acupuncture is used in conventional medicine as well as being a complementary or alternative approach. In the U.S., CAM is used by about 38% of adults and 12% of children. And any type of traditional alternative medicine is like acupuncture and homeopathy. Those fall into that same category. They're a little bit more mainstream and accepted in Western culture. They usually derive from other cultures, primarily Eastern cultures, but we accept them more readily in a lot of ways. So that's going to be something that's been practiced worldwide, though, and usually for centuries. So let's really start with the herbal supplements. These are usually made from plants, also referred to as botanicals, and are used to treat diseases or maintain your health. Some people also refer to these as phytomedicines because they're made from plants. That's really all phyto is indicating to us, and that's spelled P-H-Y-T-O. I know I'm pronouncing it phyto like it's a dog's name, but that's just my accent. It's phytomedicines. So a product made from plants is really what we're looking at for these herbal supplements, and it's used internally. In order to be a supplement, then you're taking it internally. A lot of prescription drugs and over-the-counter medicines are also made from plant products, like we talked earlier about different types of CBD medications, different ways that you take them, also lidocaine, novocaine, those kind of things that were originally from the plants that cocaine was derived from. However, these products only contain purified ingredients and are regulated by the FDA if they're over-the-counter or prescription drugs. A bunch of herbal medicine tends to be entire plants or plant parts. So we used to go to this place called Earth Fair in my hometown area. I think they're all closing down now, and that makes me very sad. But you could go over there and buy your own gel caps and then put like ginger in it for if you are having an upset stomach. You could put ground ginger in there or ground dried garlic powder. And that was really good for, keeping bugs off of us. At least that's what we found in our home, in our climate zone. So we would put all kinds of different stuff in those, and it was really helpful for us growing up. Now, we also had, Phenergan and other stuff in there that was meant to help you not be nauseous and stuff that, the doctor had prescribed. But if we could take something natural instead, then we would take the natural supplement first and then only take the other medication as a backup. Sometimes we did need both, but a lot of times it was okay just to take the ginger and get your stomach settled. You can also get all kinds of herbal supplements. They can be dried, chopped, powdered, in capsule form like the ones that we made ourselves back home, or liquid form in some cases. So think essential oils and stuff like that. Or my mom was a big fan of echinacea and golden seal. And you can use it in a bunch of different ways. So you can swallow it as a pill, you can take it as a powder or a tincture. And, don't let the term powder freak you out. A lot of people take, non-steroidal anti-inflammatory drugs in the form of goodie powders is the brand that they're called, because they're easy to mix into water or easier for people to swallow if they have trouble swallowing whole pills. You can also take it as a tincture. You can brew it as a tea, and you can apply a lot of them to your skin in the form of gels, lotions, and creams, or add it to your bath water. And we're seeing that used a lot more now in CBD and medicinal marijuana applications. So that's been really interesting to me as that's developed as well, seeing those in stores in Seattle and stuff where they have it as a lotion or a cream form. So people who don't want to smoke or they don't want to eat it have a topical option. So it's pretty fascinating how far along we're getting with that at this point in the Western world. Now, using herbal supplements goes back thousands of years. As we discussed earlier, the Romans also used different types of plants for birth control, and of course, a lot of Eastern medicine predates that by far. Now, they're getting more common among American consumers, but they're not necessarily for everyone. A lot of people in general are not going to be comfortable with them because they're not scrutinized by the FDA. There's not an overarching approving agency who is checking for the safety or for the efficacy of it in the way that we're used to with our food in American society. But that said, talk to your doctor about it. A lot of doctors nowadays, particularly those in Canada or in medicinal marijuana states, are really recommending herbal supplements when they are treating people who have diseases and illnesses such as cancer. So a lot of them are saying, hey, definitely still do chemo, because chemo is what's going to, it's what we know is going to shrink the tumor, or what we have to best equip us for fighting this tumor. However, if you are having a lot of nausea as a side effect of that chemo, go ahead and do medicinal marijuana or CBD, whatever is working best for you. A lot of people are prescribing it for epilepsy as well, particularly CBD, and especially for kids, because CBD is not going to get you high, not like marijuana. That's not the same thing. So the THC in marijuana is what really makes you high. So you can take CBD and be totally fine. So if you were worried about that, rest assured, it's all right. Talk to your doctor about it and see if that might be working for you as well. And then you are using a complementary medicine. If you're trying to use it instead of your prescribed medication, then remember it's alternative medicine. But that's why we call it complementary and alternative. So you talk to your doctor and find out what is right for you. A lot of times they're going to be a lot more open to natural medicine than you may think they would be. So the FDA considers herbal supplements to be food and not drugs. FDA is Food and Drug Administration, so they look at both. So they're not subject to the same testing, manufacturing, or labeling standards or regulations as like drugs or pharmaceuticals are, because they just look at them to be very different. It's really interesting to me that they consider herbal supplements to be food and not drugs, but marijuana is considered to be a drug, but I digress. They're just playing semantics at that point. There are labels on them, though, that will tell you how the different herbs affect different parts of your body and different actions in your body. But herbal supplement labels are not allowed to refer to treating specific medical conditions. So you're going to have to do some research on your own in a lot of cases. And in other cases, talk to your doctor about it and see if, they also agree with you that that could be helpful. A lot of herbal supplements are also not, really subject to clinical trials, and they go through different manufacturing standards from prescription drugs. So there's that. St. John's wort in particular is a really popular herbal supplement, and a lot of people believe it's useful for treating depression. And so a product label on a bottle of St. John's wort might say enhances mood, but it can't claim to treat depression because of FDA standards. So do some research and just check that out for yourself. Talk to your doctor and go from there. You do want to make sure that you don't self-diagnose and that you do discuss it with a doctor beforehand. I know I keep saying that, but remember, a lot of these traditional medicines as well as herbal supplements can interact with each other and cause side effects or strengthen the effects of each other. So we want to make sure that your dosage of either of them does not need to change based on whatever else that you're taking, and that you're not invalidating one medication by taking another. And I am including, supplements as being one of those medications. So learn a bunch about it. Talk to a doctor. If you are more into herbal medicine and you're not really keen on talking to your doctor about it, look for a doctor of osteopathic medicine. They're really holistic practitioners, and they are more likely to be really into treating your whole body. That is exactly what they went to school for. And instead of an MD, they have a DO, a doctor of osteopathic medicine. So they can do the same things that an MD can do, but their approach is just a little bit different. You also want to make sure that you discuss it with your doctor first, because you could have an allergic reaction to those different medications. If you haven't taken something before, you always want to watch out for side effects like hives, trouble breathing, nausea, dizziness, headache, upset stomach, etc. If that happens, don't take it and go talk to your doctor again. All right, we are going to go on another break, and when we come back, we're going to talk about acupuncture. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Talking about herbal medicine and herbal supplements, rather, as the FDA labels them, and they consider them to be food, not drugs. Now we're going to talk a little bit about acupuncture. So I'm very interested in acupuncture. I've not done it myself. The concept of little needles being in my body kind of freaks me out just a little bit, but I do realize I'm being a weenie and people have been doing this for thousands of years. So I'm open to trying it at this point, especially if it can help with my chronic pain. But we will delve into that today and see what we know about its safety and effectiveness. So we've done a lot of studies on acupuncture over the years, particularly as they're related to back pain, neck pain, osteoarthritis or knee pain, and headaches. That's because those are, elements that tend to affect a lot of people. And osteopathic medicine is something that we reach for when we just get to our wits' end as well about Western medicine. A lot of people start with more traditional Eastern medicine, but also a lot of people start with Western medicine and still end up attempting Eastern medicine to treat themselves as well. So because these have been around for so long, and acupuncture in particular has been around for so long, we've had a lot of studies on it. But researchers are still just beginning to understand whether it can be helpful for different types of health conditions. Remember, the placebo effect is real, so that can cause kind of a confounding variable when we are doing these studies, but that's okay. If it works, it works. So research does suggest, though, that acupuncture can help manage pain conditions, but they're not sure if you can use it to really address other health issues. So pain conditions, yes, it's not necessarily going to reverse your pain condition, but it may go ahead and help you reduce the amount of pain you're experiencing or how long you're in pain, really, but it's not necessarily going to make it go away. And that's okay. Just getting your body to stop hurting a lot of the time can be so helpful. Anytime I go to the chiropractor or I go get a therapeutic massage, I am in such a great mood for the rest of the day because I'm just not in pain all the time. And then I will nap for like 3 hours. So, more than 20 minutes isn't a nap. That's just me sleeping. But I will just get so sleepy. And I normally have a lot of trouble falling asleep and staying asleep. But doing that type of cam care for me really helps me in multiple ways for my body. It helps me feel more rested. It improves my mood. Just my wellness overall is a lot better when I get that experience. So if you haven't tried it before, go check it out. It might be for you. Acupuncture is generally considered to be safe if you're worried about people jabbing needles into you when it's performed by an experienced, well-trained practitioner who uses sterile needles. You want to make sure that they are sterilizing them because, they're jamming these into your body. I shouldn't say jamming. They're not like jabbing you with them or anything. They have gone through training in order to use these, and they should be able to do it without really making you hurt. Make sure the needles are sterile, though. You don't want to get any kind of communicable disease. So ask them about their sterilization process if that makes you feel better. And if you get acupuncture performed improperly, it can cause serious side effects. So do check into their credential process and how safely they are using these, how long they have been performing acupuncture, and all that jazz. So what is acupuncture in general? Aside from just needles, it is where you are stimulating specific points on the body, usually by inserting these very thin needles through the skin. They use it a lot in traditional Chinese medicine, and it is done in a particular way. They're not just randomly placing these needles in your body. There are specific points that they're having to do this. So don't try it at home. I don't care how many needles you have lying around your house. I don't care how much you sew or how long you've been sewing. That is not the same thing. You do need training for this because it is very specific to the different parts of your body. Now, the science about it says that acupuncture may ease certain types of pain, especially chronic types of pain. So that's the good news. If you're experiencing chronic pain and medication is just not working for you at this point, or it's not working as completely as it did before because you may have built up a tolerance to it, then go ahead and see if acupuncture is right for you. The different types of chronic pain that they've studied that have had really solid results on that have been low back pain, neck pain, and osteoarthritis or knee pain. It can also reduce the frequency of tension headaches and prevent migraine headaches. So if you are prone to different types of headaches, this could be an excellent recourse. Acupuncture does look like it's a really good option for people with chronic pain in general. And clinical guidelines, though, are kind of inconsistent about their recommendations regarding whether you should get acupuncture, or if so, how much or how frequently. So you really talk to your acupuncturist and talk to your doctor about it and see if, they can give you a good guideline, if they can agree on something for your integrative health approach. You have effects of acupuncture on the body as well as the brain, and they're still trying to suss that out and understand it from a scientific perspective. But a lot of evidence suggests that your expectations going into it and your belief as to whether or not it will work may play an important role in how beneficial it is to you. So again, placebo effect. If you think it's going to work, then it very well may work. Just like a lot of parts of life, part of this is about managing your expectations. So you can use this for all kinds of different conditions. Some of the other conditions that they have studied include cancer treatments, but they're not certain yet as to whether or not acupuncture can really help alleviate depression. There's not enough evidence in yet. They've also promoted acupuncture as a technique to help people quit smoking since the 1970s, but research hasn't really indicated that it definitely helped people quit smoking. So there is that. For cancer, it's not treating the cancer itself, it's just alleviating different types of symptoms. So that would be a complementary form of medication. It's not an alternative to chemo, radiation, or surgery. But you can read a lot about different illnesses and ailments that are impacted by acupuncture online. I encourage you guys to read more about it, not just for your physical wellness and health, but also for your intellectual wellness and health. The more we know about these things and the more we read about them from reputable sources and scientific studies, the better conversations we can have with other people about them. So what does science say about the safety and side effects? Well, there have been relatively few complications from using acupuncture. That's awesome, at least insofar as the amount that have been reported. But we can only study what's reported, so that's where we are. Complications that they have found have generally resulted from people using non-sterile needles and people not performing acupuncture correctly. So that's why we say, check those credentials and make sure that they're sterilizing everything appropriately. If you don't get acupuncture delivered properly, it can cause infections, punctured organs, collapsed lungs, and injuries to your central nervous system. So you're not trying to mess up your spine or your brain and, your brain stem. We're not trying to mess with that. So we don't want to hurt our nerves by having someone do this improperly. So definitely check that out and don't be afraid to ask these people for their credentials and their sterilization practices. You're paying them for a service, and if they really care about their practice, then they will be glad to answer those questions for you. It's not going to be offensive. They will be glad that you care enough about your personal health and wellness to ask these important questions. If they get offended about it, I would leave that office. That means that person probably does not know as much as they should about it, or they are just in general not scrupulous in those ways. Go to a different acupuncturist. You don't have to swear all of them off, but just, call another location. You can do that from home rather than going in person as well. All right, we're going to go another break, and when we come back, we're going to talk about the importance of wellness among users of CAM.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. In our last segment, we were talking about acupuncture. Now we're going to talk a little bit about a national health interview survey and what it had to say about the importance of wellness among users who were using complementary and alternative medicine. So there was this 2015 study in an online journal, the BMC Complementary Medicine and Therapies Journal, and it was talking about whether sociobehavioral wellness models of CAM can really be used to differentiate factors related to being predisposed to certain conditions, your need and personal health practices, and how that is impacted by your wellness and your combined wellness and treatment, or for just treatment alone. So they really just wanted to see how CAM plays into affecting your wellness, is the TLDR of that. They used a bunch of data from a 2007 National Health Interview Survey. It was cross-sectional and nationally representative sample. It had 23,393 adult Americans in that survey. So remember we talked before about what that means in scientific studies, and that your sample size needs to be a minimum of 30 to really be statistically significant. And the more sample you have, the more reliable your study is going to be. The more you're going to be able to see exactly what you need to see, and anything that is super odd, like we call those outliers, is going to not be upsetting to the data in a way. So what that means is that if you have something that doesn't really fit in with the rest of the data, if you are doing an average and, most of the scores average at about 300 and you have one that is at like 50, you would be like, oh no, that is really messed up, and now that's going to mess up my sample. But, if you have them averaging around 300 and you have, 20 people, that 50 is going to impact it a lot harsher than you are going to see if you have 23,000 samples that are all around that 300 level, and then you have like 5 that are at the 50 level. It just helps the greater numbers override the oddness of the lower ones or higher ones. Outliers can be in any direction. The general point is that the larger your sample size, the less the data can be skewed by those outliers. So 23,393 adult Americans is a fantastic sample size. That is like a dream sample size for a lot of anthropologists, particularly those who study skeletal remains. We might not get to that point in my lifetime, but hopefully we will at some point in the future. Now, that analysis of those 23,000 adults also included people who used at least one CAM process in the past 12 months. So that is 7,003 adult users. Anytime you see like N equals 7,003 or N equals whatever, N is telling you the amount of people who fall into that category. The prevalence estimates of that were weighted mathematically. So that means different ones mattered a little bit more than others or less than others. So they have a mathematical weight associated with them. And then they were adjusted for the sample design. What they found was that 86% of complementary and alternative medicine users reported the reason of using CAM as being for wellness. That was 51%, or wellness combined with treatment, which was 35%. So that means 51% were using it, as an alternative, and others were using it as complementary. 35% were using it as complementary to their medication or their other treatment. Now, compared to treatment-only users, wellness users were significantly more likely to be older, more educated, in better health, and engaged in multiple healthy behaviors. So they may have had better diet, nutrition, also maybe they worked out more as well. They just cared about health in a bunch of different ways. And there was support in this that found that those with health conditions were using methods for both treatment and to maintain health. So this study really found that CAM played a central role in health self-management and wellness in individual lifestyles. And I think that's really great. It overall recommends CAM as being an addition to public health endeavors, which is very positive for folks who are very into CAM. Use of CAM is increasingly becoming a part of our American healthcare and health-seeking practices, which I think is very interesting in general that we are getting to that point. We have gone from, people taking all kinds of pharmaceuticals to people not really being down with pharmaceuticals, and part of that is due to pharmaceutical costs. They are outrageous at this point, and I think it's only natural that a lot of us are turning to CAM for socioeconomic reasons, in addition to just wanting something that isn't going to pump our bodies full of chemicals. I would much rather have something natural than unnatural in my body. CAM also encompasses a range of products, practices, and providers. So that's really exciting for us as we go forward. I'm sure there's going to be a lot more that pop up as we go along. Qigong and Tai Chi are related to each other in regards to mind-body movement, but they're a little bit different in regards to the pacing and such. So Tai Chi is considered to be a little bit more hardcore, and Qigong is considered to be a little bit lighter for folks. Now that said, Tai Chi is not taxing, at least not for me. It's not physically taxing or anything. It's very chill. So when I say that one is lighter than the other, I don't mean that it is, very, very difficult or anything like that. Just that one is considered generally to be lighter. So if you've tried Tai Chi in the past and you like parts of it, but you didn't love all of it, then maybe try Qigong and see how that works for you. They found that there's a lot of social wellness to be had in CAM use as well. They found that the health services utilization of conventional care was really extended here as well. They reviewed the components of the model, and CAM was influenced by 4 distinct domains. They found that it affected people's knowledge, attitudes, and beliefs about health and illness, and there are also predisposing factors, including demographics, so where people live, male or female, their ethnic backgrounds as well. It was also impacted by whether folks had health insurance, their socioeconomic status, and their accessibility to conventional as well as alternative health services. So if you live in the middle of nowhere like I did growing up and you just have, a country doctor, then if you have health insurance and you're able to go, then you'll go see the country doctor. But if you can just grow a plant in your yard instead and take that as medication, then you might be more likely to do that, especially if you have income issues. However, if you live more in the city or just nearer to places that have a lot of CAM services, then you may be more likely to use CAM because you're more exposed to it and you're more familiar with it. So it can go either way. There are a lot of variables that influence how familiar we are with these different practices, conventional medicine and CAM, and whether we know something about it means we're more likely or less likely to actually follow through with it. That just all depends. I'm not willing to go out and just try something I don't know anything about or that I've never heard about before. I'm very much a research person, and I want to know everything I can about it. And I want to know about it from reputable sources. So I'm going to do some in-depth research. I'm going to do some Google Scholar searches, and that is what makes me feel better. So I take a scientific approach to my CAM treatments as well. A lot of folks don't believe in chiropractic medicine, chiropractic care, and I totally understand that. But for me, I've been going to the chiropractor since I was a small child, and it has always helped alleviate pain in my back and my neck and my hips. So whenever I go, I have them pop everything. They also will pop my left leg sometimes. They can't do the right one because I have that knee injury and they could make that worse. But even if you have had surgery for scoliosis and stuff, you just tell them that you've had that and they'll ask if you have any rods in your body or anything like that so they can avoid those areas and safely work on the other areas. It's not going to fix scoliosis. It's not going to really affect anything in your body in a way that can reverse a problem, but you can treat the ongoing pain. So if you have chronic pain, go ahead and go. My back is really, I don't want to say it's killing me, like it's not literally killing me, but figuratively. I woke up a little bit ago and it is already screaming in a lot of ways. So I need to do my yoga and flexibility poses. So I do fish pose for that a lot and move my arms in different ways, almost like a snow angel thing, but on the yoga block so that I can really address where that muscle pain is. And if that doesn't work, I'm going to go to the chiropractor and have them give me an adjustment. That works for me, and that's what we're really looking for, is what works for each of us. I would rather go to the chiropractor than take ibuprofen for this. Nothing against ibuprofen. I just don't want to pump NSAIDs into my body. That's just me. If you can manipulate the outside of the body and do that instead of putting stuff on the inside, I'm going to go for that most of the time. All right, we're going to go another break. When we come back, we are going to talk about relaxation techniques for health.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Before the break, we were talking about different types of CAM and how it can impact our wellness and some positive scientific research that supports it. Now we're going to talk about relaxation techniques for health. I'm a big fan of relaxation techniques, and they've done a lot of research on these. So fortunately for us, that means we have a lot we can learn. However, a lot of the health conditions they have studied, the number or size of the studies have been small, and some of the studies haven't been of great quality. So we want to really keep that in mind when we're reading these things, that just because they have conducted a study doesn't mean that they did it well, or that they had a large enough sample size, or that they've done enough studies to have solid repeatability. So we can see that, oh, okay, these different people from different organizations who are not funded by the same people have done these studies and have still found the same thing. That's going to lend some credence to their findings if they have been conducted by different people at different organizations and are not funded by the same people. Because just like we look at research for the pharmaceutical industry, if we go, oh, hey, they did the study that says that this certain medication is really good for you, but it was funded by the company who makes that medication, you would be skeptical about that, right? Shouldn't be any different with CAM. We want to make sure that we are applying that globally so we aren't being hypocrites, but also so that we're protecting our health. So that's important in our wellness aspects for our intellectual wellness as well as for our general overall well-being. So what do we know about the effectiveness of relaxation techniques? They can be really helpful in managing a variety of health conditions. So that includes mental health issues, insomnia, anxiety associated with illnesses or medical procedures. So if you have a lot of anxiety about the dentist or about surgery, they've done several studies about that. They can also help you with labor pain. Ladies, if you had a baby, I would love to hear from you about whether you think the relaxation techniques really helped you out. I have not personally birthed a child, and I'm very interested to hear individual stories in addition to these scientific studies. It can also help with chemo-induced nausea and TMJ. So if you have temporomandibular joint problems, then they have found that relaxation techniques have helped with that. They've also done a lot of psychological therapies with relaxation techniques to manage chronic headaches and other types of chronic pain in kids and adolescents, so not just adults. They've been studying this for a long time and have checked it out for a bunch of different conditions, but several other conditions haven't been shown to be useful, or the results have been inconsistent, or the evidence was really limited. So just because we get results does not mean that they are statistically significant, but some people who do studies are not super familiar with how statistics works, and so they will try to stretch something to look a certain way not because they are being malicious per se, but because they don't understand it. So there is a general philosophical rule that says never attribute to malice that which could be attributed to ignorance. So we don't want to say that they're doing it on purpose, but some folks just, they don't understand the math as well, and that's okay. The other scientists will generally take them to task for that. That's why they write into the editor and everything for these journals. So if you're not familiar with journal articles, there are these journals and they are peer reviewed. So their peers go ahead and review it in several cycles before they can get the article accepted to the journal. And then if people disagree, then they can write in as well. And sometimes they will get retracted at that point. I also had a professor in grad school who taught our anthropological statistics course. And the whole point of the course for him was making sure we understood why we were doing specific tests. And so on our tests, it would be like half of the problem was figuring out how to get the answer that you needed. So it wasn't just about doing the statistical equations. It was just presenting us with a problem and going, hey, you have this set of Neanderthal crania and you are trying to figure out A, B, and C. What is the answer to this? And so you have to identify the correct problem or the correct equation to use for it and use the equation and the correct approach in general. So whether it's a one or a two-tailed test, or if you're doing an analysis of variance or a chi-square test, he really took us in depth into that. And he also likes to read these journal articles and make sure that other people's statistics are correct. That's just one of his hobbies. And it might sound a little pedantic, but I think it's great. But then again, I'm also a person who will read anatomy journals and write into the publishers that something is incorrect. But they do write back to you. They're really cool about it. I think Macmillan wrote back to me and thanked me for it, and then they fixed it in a future edition. So that is one of our jobs as scientists, is to make sure that the science is ethical and reliable and perform correctly, and to reach out kindly to fellow scientists if something has kind of gone wonky or haywire with the math and a mistake hasn't been caught. So rest assured, the other scientists are keeping an eye on that as well. So what do we know about the safety of these relaxation techniques? Those are generally considered to be safe for healthy people. There have been a few reports of experiences of increased anxiety that were not positive, but then in general, if you are overall healthy, then this should work for you. People with serious physical or mental health problems should talk about it with their healthcare provider first. So with some of these relaxation techniques, you're relaxing and clenching muscle systems. So that's why they include people who have physical ailments in mentioning this. So it might not just cause increased anxiety or be associated with increased anxiety, but it could also potentially be harmful to your body, depending on which relaxation technique you use and what your specific body is going through on a day-to-day basis. So let's talk about the different types of relaxation techniques. There are a number of them. There's progressive relaxation, guided imagery, biofeedback, self-hypnosis, and deep breathing exercises. But the goal is very similar in each of those, to help your body's natural relaxation response be produced. That means slower breathing, lower blood pressure, and a feeling of general overall increased well-being. Now, my body is stiff a lot of the time, and I clench a lot of my muscles, so I do a specific relaxation technique with the progressive relaxation, and we'll talk about that in our final segment. But for now, let's talk about the other types a little bit. Meditation can also be really helpful in this regard if you are marrying it with movement. So my ex does a lot of meditations. He's done 4 or 5, I think, over the past 8 years that I've known him. And in that time, he has done one that is really physical and is also associated with yoga. So I've seen him do, the Ashtanga, sun salutations, and the Chaturanga and stuff as he is doing these meditations. And he really liked those a lot. Make sure you lay down a yoga mat, though. It will make your carpet sweaty. You might not think yoga is going to make you sweaty, but it will, even if you're doing it while meditating. You can also marry it with Tai Chi, and that's going to help you relax because it's about focusing on your breathing and your movements, and just being mindful in general for both of those. So maybe those could be for you. Stress management programs also really commonly use relaxation techniques. So if you in general are experiencing a lot of stress, right now, I'm going to remind you guys again, go ahead and relax your jaw, drop your shoulders. There we go. And that might make you feel a little bit better right now. Just take a slow, deep breath and relax a little bit. A lot of times we will unconsciously be clenching our jaw and other parts of our body, and really consciously relaxing them helps a lot. I try to do that multiple times throughout the day, particularly when I'm sitting at my desk. Now, a lot of different relaxation techniques have been studied to see whether they might be helpful in managing a host of different health problems, and you can find them in autogenic training. So autogenic training means you are learning to concentrate on the physical sensations of warmth, heaviness, and relaxation in different parts of your body. There's also biofeedback assisted relaxation. So in that one, those techniques measure your body functions and give you information about them to help you learn to control them consciously. They also use electronic devices to teach you to produce changes in your body that are correlated with relaxation, like reducing muscle tension. So you might want to talk to your doctor about that. I have a TENS unit that I purchased on my own. You can purchase them on your own. You can get them from a doctor, etc. But it's usually good, if you're not familiar with them already, to speak with a medical practitioner about it first. My mom had one growing up, and she got it from the chiropractor, and I always went with her to her chiropractor appointments and also helped her place the little electrode pads on her body. So I am familiar with how to use those, and I know not to put it above my heart level and everything as well, because that can perhaps cause some wonky issues. So I felt really comfortable in purchasing mine because I already knew a lot about it. But check it out and talk to your doctor if you think that that might help you. A lot of times, my TENS unit really helps me out a lot when my back hurts. And I'm really glad we're talking about this right now, because that reminded me I need to go charge it so I can use it. But it sends these electrical impulses into your muscles, and that's really what moves your muscles, is essentially electrical impulses. So it's tensing them and then releasing them in a really rhythmic pattern. So it's in a sequence time progression, and that is really helpful for releasing a lot of that muscle tension. I'm a big fan. If that sounds interesting to you, check it out. They don't necessarily hurt. Mine goes all the way up to like 20 in regards to like intensity. And it has, I think, 6 different modes for it. So one of them is like a more concentrated little jab. And then another one is almost like a big thump. And another one is like you're getting a massage with, where you're hitting somebody with like the heel of your hand. So there are so many different types in there, and you should always start out at one and gradually increase it. And if you have to move it on your body, pause it, like stop the thing from emitting electrical impulses, or you're going to shock yourself while you're moving it. And it's going to feel a lot stronger, that electrical impulse, when it is on your fingers versus when it is on your back, because it's spread throughout a larger muscle mass. So make sure you pause it first and then move the electrodes and replace them, and then go ahead and turn it back on. But anytime you move it to another part of your body, I also recommend moving it all the way back down to one. And keep in mind, I'm not a doctor. I'm just telling you guys about my personal experience and what I've researched. So do talk to your doctor. Don't just take my word for it. You can also do deep breathing and breathing exercises. So just focus on taking slow, deep, even breaths, and doing guided imagery. You can focus on just pleasant images to replace negative or stressful feelings. You can do that on your own or be led by a practitioner or a recording. Roger, my ex, he does a lot of guided meditations for people, and it's really great, where he can really help people by just sitting down with them and saying, okay, now you're going to envision this. And usually it's just like a light coming from different parts of your body. It's a mindful meditation, and it is really helpful. That's the one that if I'm going to do a meditation, I would do that one. It's my favorite. I'm not really into a lot of meditation because, I have trouble sitting still a lot. So if I'm going to be meditative in a way. I want to walk out in nature and cultivate awe and look at animals and stuff in their natural habitat. And that helps me calm down. It helps my blood pressure lower and my breathing slow. So all the things you're trying to get out of meditation, but it's more of a walking meditation for me. And there are actual walking meditations as well, if that also sounds more your speed. But you can also go online and do a guided meditation. They have a ton of them on YouTube. There are a ton of apps as well that you can get to, give you this imagery that you're supposed to think about while you are slowing down your breathing and focusing on relaxing. There's also self-hypnosis. So people are taught to produce a relaxation response when prompted by a phrase or a nonverbal cue, and that's called a suggestion. So that's really interesting to me as well. You can go online and check out all the different ways to use relaxation techniques for different disorders. They've been shown to help with nightmares, with nausea, menstrual cramps, PTSD, rheumatoid arthritis, tinnitus, helping you quit smoking, high blood pressure, IBS even. Really, there have been so many different studies. We're just talking about them at a high level today instead of diving into them. So check those out and see if something that you're going through could be positively impacted by progressive relaxation or any of these other types of relaxation. We're going to go on another break, and when we come back, we're going to talk about progressive relaxation and how that helps me in my life.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
We were talking about different types of relaxation techniques. There are so many out there that I'm rather sure you would find one that is right for you if you go online and check it out. And science has shown that there are so many different disorders and ailments that can be treated with relaxation techniques. So I encourage you to check that out. I'm not saying it's going to completely fix it for you. Remember, this is complementary medicine in addition to alternative medicine, and I really focus on the complementary aspect of it. But if it works so well for you that you can use it as an alternative to whatever else you are having to do in your treatment plan, that's awesome. So check it out, see if it works. For progressive relaxation, that is what we're going to talk about next. That is the technique that I tend to use each day. I use it multiple times a day, and I also use it when I am trying to go to sleep. That technique is also referred to as Jacobson relaxation or progressive muscle relaxation. And what it really means is that you focus on tightening and relaxing various muscle groups. It's often combined with guided imagery and breathing exercises, so it's almost like a meditation in a lot of ways, depending on how you practice it. I don't use guided imagery with it, or really breathing exercises per se. I do tend to breathe more slowly and focus on that, but primarily my focus is on my muscles relaxing at that point. You can think of this as like an all-over Kegel is really what it is. And remember, if you're doing Kegel exercises, it's not just about the strengthening of the pelvic floor, but it's also about the full relaxation of it. You don't want a strong pelvic floor. You want a flexible pelvic floor. I didn't realize that for a long time, and that did cause me some issues. Ladies, you know what I'm talking about. So it is important that you fully relax in between each Kegel. You can do your Kegels wherever you are, just consciously clenching those muscles and then relaxing them. But make sure that you relax them completely. Otherwise, you're pretty much just going to end up with a really jacked pelvic floor muscle, but it's not going to have as much give. So just like when we're working out the rest of our body, we want to make sure that not only our bodies are strong, but also they're flexible to prevent injury or muscle strain or anything else. So we can think of progressive relaxation as an all-over Kegel, and you're really thinking about how you are tensing those muscles as you breathe in, and then you relax them as you breathe out. And you work on your muscle groups in a certain order for this. It helps to relieve tension, like physical muscle tension, and just stress and anxiety as well. So if I'm starting to feel stressed, I will start doing progressive muscle relaxation. And the great thing is you can do it anywhere, just like Kegels. You can do it in traffic, you can do it in your office, you can do it at school, wherever you're at. People aren't really going to know what you're doing. They're not going to be able to physically notice for the most part. So that is also a plus if you feel weird about the concept. Now, when your body is physically relaxed, it helps prevent anxiety. So that is one of my CAM techniques for my anxiety in addition to my conventional medicine of the Prozac. When you practice this for a few weeks, it's going to help you get better at it. And then in time, it's really going to be helpful for relieving stress. So I first started doing this a couple of months back when I realized that I was clenching the muscles in my entire body pretty much all day, every day. I was like, why am I always in chronic pain? And it's because I was really stressed out at my old job. Now, I did quit that job, which was awesome. And I encourage you guys to explore your options and explore where the stress is coming from in your life to see if you can address it in different ways. For me, that really helped me out a lot. Now, I'm not saying quit your job without a backup plan. Make sure that you do have your backup plan in place. And in general, I advise people to make sure you have another job before you quit your other job, or you have one lined up, or you at least have several months of money that you can draw from in order to give you a break while you're looking for another job. But there's a lot more information on the internet about that if you guys are interested in it. However, for me, leaving that job helped me out a lot. I was stressed out all the time. Even though I was good at my job, I just didn't like it. I really, really didn't like it. And so I left, and it was one of the best things I've done for me. But after I left, I realized that when I wasn't getting those stressors all the time, like my body was still hurting. And I was like, why is that happening? And I realized one day that all of the muscles in my body were clenched, like constantly. My pelvic floor, always clenched. My butt cheeks, always clenched. Like my shoulders, my pecs, everything. I was just constantly clenching my neck and my jaw and everything. And it was just from being stressed like that all the time. So now I have started consciously clenching and then releasing them. And that has helped a lot in general with my chronic pain. It has also helped a lot with my hip pain. I used to have a ton of hip pain all the time, and now it is a lot better. I am not experiencing that, and it is just so nice to not be in pain in that regard all the time. Now, another big part of that was getting out of my recliner. So I have a couch that reclines. That was kind of the whole appeal of the couch. It's not a good couch for laying on. It is just a nice sitting couch for the recliner, but that was really messing up my lower back. My chiropractor told me that. He's like, are you using a recliner every day? And I'm like, yeah. And he's like, well, cut it out. He's like, I used to use one, and I was using it, for at least 2 hours a day playing video games with my buddy after work, and it really hurt my lower back. He goes, I guarantee you if you stop using that, it's going to help you out a lot. Now, I also have really short legs, so one of the things that has helped me is to put a small box or something under my desk so that my legs can rest naturally. That is super helpful. You want to make sure it's not putting tension on your lumbar spine. I have one of those little mesh and wire things in my chair that also is supposed to be ergonomic and help my lumbar spine out a lot. But if my legs are dangling, it's still pulling on it. So get you a box. I had a box full of Harry Potter books actually under my desk in the office. That helped a ton. And when I was trying to build my new desk, I built it to my height. Most desks are built for the height of a man who is like 5'9", I think. Don't hold me to that. I don't remember quite off the top of my head specifically what size it was, but it was well taller than me. So not only was it not ergonomic for my arms, but also not for my legs and everything. So I purchased some new chairs that are mid-century modern from a local antique shop, and then I built my desk to match it. So it has, the really nice chrome-plated legs and everything, the hairpin legs, and it is maple on top. It's maple plywood, just like the chairs are. Chairs are molded maple plywood. But I also made sure that it was at my height. So my elbows can rest appropriately on it, so my shoulders aren't all hunched up around my neck, and also the chair is closer to the ground. So it's still a little bit too high for me, but I went ahead and I put my little bike machine under there, so I have something to rest my feet on so my back isn't hurting anymore. And sitting at a real desk instead of at, in my recliner. Let's be honest, that really helps me a lot more. I work from a laptop, so that was a big thing for me. Also, if you build your own furniture, I know that's not for everybody, but if you do, you can go online and get different lengths of table legs. So mine are metal. I didn't use wooden legs on this. Wooden legs you can cut to whatever length you want. But the metal ones, I'm not a metal worker, so I had to order them. But they are about 25 inches tall. It's hard to get them to be like 25 inches or 27 inches because they tend to come in even increments. But mine are about 25 inches, and that is the best for me. So you can go online and actually Google that for yourself as well. And to be honest, it was a really great decision I made. It probably didn't cost me more than like $170, which, I could have gotten a much cheaper desk somewhere else, but part of it was building the desk. That was a catharsis for me. That was for my emotional wellness as well. And I also just enjoy the challenge of building something with my own hands. So for me, this was a wellness project, but now it's also helping with my physical wellness because it's not pulling on my back anymore and it's built to my specific requirements. Another thing you can think of is perhaps putting in a little footrest bar on it if you're building your own, particularly if you're using metal piping like an industrial style desk. That was one of the other things that I thought about doing was putting a bar in there. And I'd asked my chiropractor, I'm like, what size should I build my desk to? And he's like, why don't you just get a box to put your feet on underneath it? And I'm like, okay, that's fair too. That's fair. But I want both. So you can also put a little bar across the bottom, kind of like they have in a lot of bars and clubs, for your feet to rest on so that it is at a more comfortable level for you if you don't like the look of having something under your desk so much. So I recommend that. I also recommend, this relaxation. So setting myself up for success in releasing some of the stress by paying attention to the ergonomics of what I am sitting in and what I am doing each day was really helpful. But also releasing those muscles really helps a lot. Now, you do want to do these in a certain order. And if you do, you want to maybe use an audio recording until you kind of learn the muscle groups in order. You can go online and find that, or check your local library or bookstore for progressive muscle relaxation recordings. And if you have trouble falling asleep at night like I do, this can also help with your sleep problems. So how do you do this? Well, you're going to choose a place where you're not going to be interrupted in general and where you can lie down on your back and stretch out comfortably. So a carpeted floor or at your desk. It says lay down, but, sometimes we just need to relax part of it as we go along throughout the day. And sometimes I'll just do my torso. But when I go to bed at night, I do that in my bed. So you breathe in and you're going to tense your first muscle group on the list, and then make sure you're not tensing it to the point of it hurting or cramping in any way, but you're going to do it for about 4 to 10 seconds. And then you're going to breathe out and go ahead and relax that muscle group. Relax it all at once. You're not trying to relax it gradually. Just suddenly and completely relax it. Then you're going to chill for about 10 to 20 seconds before you work on the next muscle group. You're going to pay attention to the different way your muscles feel when they're tense and how they feel versus when they're relaxed. Then when you're finished with each of your muscle groups, count backwards from 5 to 1 to bring your focus back to the present if you are using this as a meditation as well. After you've learned how to tense and relax each of the muscle groups, then you can try some other techniques. And when you have very tense muscles, you can practice tensing and releasing that muscle without going through the whole routine, just like I do at my desk. So for the techniques, if you're lying down right now or if you're somewhere where you can do this, for your hands, you're going to clench them and then release them. For your wrists and forearms, you're going to extend them outward and then bend your hands back at the wrist. That's really going to help. Oh, yeah, that feels nice. So I'm doing this a little bit as I'm talking to you guys too. And it really helps with my forearms. I'm prone to getting tendinitis from being on the computer so much, so I do this one quite a bit. You can also do your biceps and upper arms by clenching your hands into fists, then bend your arms at the elbows and flex your biceps, like welcome to the gun show. It's exactly what it looks like. Remember, hold that for 4 to 10 seconds and then suddenly release it. With your shoulders, shrug them, so raise them up towards your ears and then let them go. Forehead, you can wrinkle it into a deep frown. So if you are worried about wrinkles, you might not be super excited about this one, but our facial muscles can also tense up. Around your eyes and the bridge of your nose, I'm prone to getting headaches there, so this was a big one for me. You're going to close your eyes as tightly as you can. If you wear contacts, though, take those off. You can leave your glasses on, but you might want to take the contacts out before you do that one, or just avoid that one until you're able to go home and take your contacts out. But squeeze your eyes shut really tight and then go ahead and open them. So whenever I do that one, I always see like fuzz, like what's on the television. In the old days, I guess children today don't know what snow or fuzz on the television looks like. Oh, that's weird to think about that. I guess I'm getting old. But it looks like, all that static on there. Then with your cheeks and your jaw, smile as widely as you can. Remember, smile therapy is good for us anyway and will help improve our moods. So 2 birds, 1 stone here. And then you're going to hold it for 4 to 10 seconds and let it go. That one always makes me want to yawn a little bit too. So overall, super helpful. Around your mouth, press your lips together really tightly and check your face for tension. You want to make sure you're just using your lips for that one and not like your entire face clenching. And then for the back of the neck, press the back of your neck against the floor or your chair or something. So you want it to be against something that is flat. And that is really going to help a lot because we tend to lean forward a ton throughout our day, especially when we're on the computer or if we're looking on our smartphones. We spend a lot of time looking down. It promotes those wrinkles on our necks, and it also is not great for our spine. Now, for the front of your neck, touch your chin to your chest. You're not creating tension in your neck and your head. You're just trying to touch your chin to your chest. And then for your chest, take a deep breath and hold it. I do that one a lot, not just for my chest, but also for my lungs. Makes them feel a lot better. And then for my back, you're going to arch it up and away from the floor or your chair or your bed, wherever you are. Hold it 4 to 10 seconds, release it. Stomach, suck it into like a tight knot. You can kind of imagine a little string between your stomach area and your chest. You don't want to be clenching your chest, just your stomach area. But, around your belly button, you want a little bit of a string going from like the top of your pelvic area to a little bit above your belly button. And that's really going to help a lot. Then with your hips and buttocks, press your buttocks together tightly and then release them. You might feel silly doing it, but it is really going to be helpful. Sometimes my hips even pop when I do that one. Your thighs, you're going to clench them really hard. And then for your lower legs, point your toes towards your face, then point your toes away and curl them downward at the same time. I like to follow the Psyche Truth YouTube video for that. I don't know what else they do. I don't know what Psyche Truth even stands for, but there's 1 exercise or 2 exercises on there that I really enjoy. And a third one for if you're wanting to learn how to do the splits. And they're just for flexibility. So they're about 11 to 14 minutes long each. And I like to do those each day to help me out. And they really help with with lower body flexibility especially. So you can touch your toes and all that stuff. All right, guys, that is all I have for you today. I hope that really helped you out and you guys feel some type of way about complementary and alternative medicine. There are so many different kinds. We'll talk about more of them in the future. But for now, I hope y'all have a great day. Release those shoulders and remember to drop them and release your jaw tension throughout the day. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly. Have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.